Joe Muriuki is a well-known name in Kenya. He was the first Kenyan to boldly go public about his HIV status. The doctor who had diagnosed him informed him then he only had about 3 months to live. But the 3 months passed by, then 6, then a year, and now 36 years. He is currently on ARVs, to which he also credits to his good health. However, in April this year, Joe was diagnosed with esophagus cancer and started treatment right away and did well with the chemotherapy and radiation. NTV's Rose Wangoi met the HIV hero and filed the following report.
Getting to where he is now has not been an easy journey, but Joe Muriuki is indeed an extraordinary man. His is a tale that kept the nation talking when loud silence was a norm. Joe was the first Kenyan to go public about his status soon after he tested HIV positive.
I had struggled with the infection without knowing what was happening since 1986. But the first test that I got was actually 1989. There was very little information about HIV, plenty of stigma, and a lot of profiling and name calling and all these kind of things.
A new dawn came when he first accepted himself and the fact that he had to live with his condition.
I was lucky. I had a very good, very supportive family, and very supporting wife, very supportive children, very supporting relatives. And as you can see now, the reality of the fact is that I have lived with this HIV now for 36 years. The ARVs just came on board about 10 years ago. During all that time, I was surviving on what we call positive living, ensuring that you are on proper diet. So that's how I managed that period when I was not on ARVs. And it worked because I rarely also experienced any bouts of infections.
But in early 2020, his health started deteriorating.
I discovered again I had problem with swallowing. I could not swallow. Whenever I took some food. Around April this year, I sought medical attention, and I went through a series of examinations. They discovered I had esophagus cancer. And this esophagus cancer had actually affected about 12 centimeters of my esophagus. I was immediately put on medication. I had to undergo radiotherapy on daily basis for 1.5 months every morning. And I had to undergo chemotherapy at the same time, once a week. By the time I was through with about that 1.5 months, I can assure you, I can tell you that I had lost about 33 kg. So I still have a lot of problems swallowing. I can't swallow anything solid. All that I can do is that even if I have food that I have to swallow, to eat, I have to chew the food until it is watery. I have to take food for maybe 2 or 3 hours before I can get enough that I can't swallow ARVs. The esophagus is very narrow. So what I have to do, crush the medication and dissolve it in water, sometimes in uji, sometimes in juice, and then swallow. But I can assure you it's not a pleasant kind of experience. They are very, very bitter. And in most cases, I vomit. Treatment for cancer is damned expensive in this country. Actually, I was going through this treatment in Kenyatta, Kenyatta National Hospital, where it is said is the cheapest. But every day, every one session for radiotherapy, I had to pay 3,600. I would hope that the government would put measures. If the NHIF was to go an extra mile and make treatment for cancer easily accessible for people who need it, especially who have also the infection of HIV, then one would not have to worry so much. There's nothing as scaring as COVID right now, and for somebody like me I have to be very careful. I don't think I would survive a COVID attack. And my age is also advanced because I'm around 62 years. But I was the first in the queue to go for the jab, so I've already received both of them.
Jomo Rioki is a lecturer of epidemiology, but for now he has to take it easy as chemotherapy has taken a toll on him.
In 2004, and that is the time I started my bachelor's. Even with these struggles, I've gone through until I've earned a PhD. So it's not that you can't actually manage it.
HIV has been with us since 1984 and our understanding has been transformed in this time. Stigma is down and treatment is readily available. However, Joe warns that this is not the time to relax.
The infection right now is quite big among the students, especially in the universities and those young age. That's where the infection now has gone to, because of course they are a bit careless of I think they kind of think that the HIV ceased to be an issue, but it is. It's a serious medical problem. People have to take care. It may look like there isn't so much danger, but there's still a lot of danger because you still can be infected with HIV.
But Joe's story continues to inspire millions more who have to face the virus each day. Rozongoi, NTV.